Good morning, everyone. Love this chatter this morning. Thanks for being here. Welcome to Know and Go Friday. Welcome back to most of you. I see a lot of familiar faces. I'm Holly Brenner, the Vice President of Strategic Development and Marketing for our system. I appreciate that you're here. Our whole team appreciates that you're here. Before we get started, I will share a quick reflection that Colleen gave to me that I thought was pretty good. It's called "It Couldn't Be Done." Somebody said that it couldn't be done, but he with a chuckle replied that maybe it couldn't, but he wouldn't say so till he tried. So he buckled right in with a trace of a grin. If he worried, he hit it. He started to sing as he tackled the thing that couldn't be done, and he did it. Somebody scoffed, "Oh, you'll never do that. At least no one ever has done it." But he took off his coat and he took off his hat, and the first thing he knew, he'd begun it. With a lift of his chin and a bit of a grin, without any doubting, he started to sing as he tackled the thing that couldn't be done, and he did it. There are thousands to tell you it cannot be done. There are thousands to prophesy failure. There are thousands to point out to you, one by one, the dangers that wait to assail you. But just buckle in with a bit of a grin. Just take off your coat and go to it. Just start to sing as you tackle the thing that cannot be done, and you'll do it. There's a lot of things that we face every day that seem insurmountable, but really, when you sit back and just dig in, usually they're not quite as bad as you thought. Next month, we will have, our conversation will be on interventional radiology, which should be an interesting topic. That is September 6th, so 8 o'clock here, same time, same place on September 6th. So if you can set that time aside, that would be great. As a reminder, Know and Go Fridays are designed to help inform us as associates, educate us on important health information and topics, also to introduce us to the providers within our system who provide those services, or the professionals within our system who provide those services. So when you need the information or someone you care about needs health care, you'll be well informed as to what it is we offer here within Agnesian HealthCare. So this morning we have Dr. Weber, family medicine provider with the Fond du Lac Regional Clinic and Agnesian HealthCare, as well as Tyler Schwartz, who's one of our licensed athletic trainers with Sports Spine and Work Center. They're here to talk to us about a diagnostic tool that we offer within Agnesian HealthCare called impact testing. In short, it's really used to analyze the severity of an athlete's head injury or concussion during competitive sports. So here they are to fill in the details for us. So the floor is yours.
First, I'm going to talk about concussions, and I have this labeled as from injury to return to play. Just so you know, concussions don't just happen in athletes. They do happen in everyday people, and we do treat them too. So I will talk about that a little bit later. So we're going to take a look at concussions and how to treat them. So what our objectives are is we're going to go over what a concussion is and what is actually happening in the brain. How to treat them. Different things have changed lately. There was a Zurich conference, which is an international conference that just took place in 2012, and they came out with a new position statement on concussions. Wisconsin state law just was approved, I believe, 2 years ago now. And then we'll talk about our process here at Agnesian HealthCare, which is a process that's ever changing. As we learn more and as more information comes out about how to treat and take care of concussions, we always alter our process a little bit to try to make sure we're giving the best care possible. Then we'll go into a little bit more on our neurocognitive testing, which is impact. So we'll tell you what neurocognitive testing is, the different programs including impact. We'll go through a sample test, and then Dr. Weber will come up and go over how to read an impact test and then how to use that to implement in the treatment plan. So this is the newest definition of what a concussion is. It is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head that can change the way your brain normally functions. Concussions can also occur from a fall or a blow to the body that causes the head and brain to move quickly back and forth. It's no longer a violent movement anymore. That's the biggest change in the definition. It went from a violent movement to now it includes everything. A simple bump can cause a concussion. So what is it? It's a typically results in a rapid onset of short-lived impairment that does resolve over time. The nice thing is the brain will heal itself. Can be caused from a minor hit or blow, does not have to involve that big hit, and is a multi-symptom injury that varies from person to person. No two concussions are ever the same. It's actually a metabolic or chemical imbalance or dysfunction within the brain. It's not what everybody used to think it is, which is a bruise. Nothing will show up on a CT scan for a concussion. If it does, we have more serious issues to look at than a concussion. And one thing on here that is very important to understand, children do take longer to heal because their brains are still developing, so everything changes. Two main causes, a deceleration or linear cause and which means the brain moves forward in the skull, and the frontal lobe strikes the inside of the skull, and that's where the contusion takes place. Or you can get that rebound effect where it strikes on the back of the skull. And then a rotational where the brain rotates on its axis, and that's when you get the stretching and tearing of the axons there. It also stretches and tears some blood vessels, which can result in hematoma. And like I said, the brain strikes the skull, causing the contusion. There's 3 ways these usually occur. Direct blow to the head. Impact from the head hitting the ground on another surface. So a soccer ball, ground, anything like that can cause a concussion. And the last one is the whiplash effect. So this is the sudden deceleration. You're going one way, you're changing direction very suddenly, you get that whiplash effect. So what's actually happening? This is normal function of the brain. So you have your neuron. Your neuron receives information from another neuron, and what happens is it takes all the potassium here and it starts to transmit that signal down the stem. And then it gets down here and the neurotransmitters transmit it to the next one. When we get a concussion, during that injury, we actually get this stretching where these neurons actually flex and they stretch and they'll actually tear apart from twisting and stuff like that. So what we'll do is this potassium will start to come out and calcium ions will start to go into the neuron. And that's toxic to that neuron. So it causes that neuron to not function correctly. So now, with this metabolic dysfunction, you get what we call an energy crisis. Excuse me. So during this energy crisis, the neurotransmitters are rushing out of the cell. So they're sending a ton of information. This next neuron that may not be damaged doesn't know how to interpret what's coming out. So it's the same thing. When you were younger, you used to play that game where a teacher would tell one person a thing. By the time you got to the 5th person, you got a different sentence or a different statement. It's the same thing going on here. One neuron's passing something on, it gets to the neuron that is damaged, and that neuron is jumbling everything up, and when it goes to pass it on, you're not getting the correct information. So that's what's actually causing a lot of our symptoms. So you'll see it here too, and at this point in time, that's when the brain or that neuron is extremely vulnerable. So that's when it's vulnerable for another hit or any other damage to it that causes more of the catastrophic or permanent type injuries. So how do we treat it? In 2012, they had the 4th International Consensus Statement on Concussion in Sport, which was held in Zurich again. And what they came up with is any player should be evaluated by a physician or other licensed healthcare provider. If no healthcare provider is available, that player should be safely removed from practice or play, and an urgent referral should be arranged. Okay? The assessment of the concussion should be made using a SCAT-3 or other sideline assessment tool. SCAT-3 is a tool that any of the doctors that do deal with concussions know what it is and have dealt with as athletic trainers. We use it all the time for all of our concussions. We are actually using the SCAT-2 right now, and the main reason for that is we actually are using a computerized program for our injury stuff, and that has the SCAT-2 still in it. They haven't switched over to the SCAT-3 because they haven't came out with an electronic version of it. Everything's still paper because it's fairly new. So then that player diagnosed with a concussion should not return to play the same day of injury. That makes no difference whether it is a youth athlete or a professional athlete. You see now how the NFL has changed, and a lot of it is because of a lot of this different stuff, that almost any athlete that is suspected of having a concussion in the NFL no longer plays that game anymore, because they actually now have an independent doctor that is actually coming in, not a team doctor, that determines whether or not they have that concussion or not. So there is somebody else there, so I mean you will see some, but very few. The key to concussion management is physical and mental rest until the acute symptoms resolve, and then a graded program of exertion prior to medical clearance and return to play. And then the last one important here, this is what we use, and we'll talk later. Neuropsychological testing in concussions has been shown to be of clinical value and contributes significant information in concussion evaluation. So then in April 2012, Wisconsin became, I believe, the 30-some state to actually pass a state law on concussions. And what that does is that requires all youth organizations, whether it's high school sports, rec league sports, whatever, any organization that runs a youth sport, to educate coaches, student athletes, and parents on the risks of concussions, and prohibits participation in a youth activity until a parent or guardian has returned a signed information sheet indicating they have reviewed the materials. Any parent that has a kid playing high school sports, they understand what this is because they have to sign one before every sport. It's not just one a year, it's every sport. So what they're trying to do is they're trying to make the parents more involved instead of just telling the kids what's going on. Because as I tell anybody when I talk about concussions with high school kids, because that's what I deal with mainly, they're going to lie to me. Their biggest thing is they want to get back out of that court, that field to play. So they're going to lie about what they're actually feeling. Excuse me. It also states that an athletic coach or an official involved in a youth activity or a healthcare provider shall remove a person from the youth activity if the coach, official, or healthcare provider determines that that person exhibits signs, symptoms, or behavior consistent with a concussion or head injury, or is suspected of sustaining a concussion or head injury. Then it also says that that person who has been removed from that youth activity may not participate again until he or she is evaluated by a healthcare provider and receives written clearance to participate in the activity from the healthcare provider. I don't have on here, but when it does say healthcare provider on there, they're talking about, it also states when it does the definition for healthcare provider, that person has to be trained in the actual care of concussions. So a chiropractor that knows nothing about concussions can't just write a note that says, okay, I don't think that kid has a concussion, you can go back to play. So they are trying to make sure that the proper care is being given to those concussions. Now, how do we at Agnesian HealthCare treat a concussion? What we're going to do here is we'll take you through a sample, an idea of what would happen. So we get an athlete that gets a concussion or a head injury during a football game on a Friday night. The athletic trainer performs a SCAT-2 sideline exam and determines that that athlete, I say has a concussion, but what we do is we determine that they don't, we can say that they can't say they don't have a concussion. If we're not positive, 100% positive, we can say you're fine, we automatically classify them as having a concussion. Because that's our way of making sure we're trying to do everything we can to not put somebody back in where something worse can happen. The athlete is removed from competition, and then either during or after the game, the athlete and parents are informed of what to watch for and what to do. A lot of times we wait till afterwards unless things get to the point where we want to actually send them early. So then we'll talk to the parents so they know what to watch for. Because a lot of times, a lot of the stuff we see acutely can change. A concussion changes all the time. So a lot of times they may start to develop more symptoms that we don't get to see acutely, that we're going to warn those parents what to look for, so if something worse does happen, we can get them sent in and taken care of. Okay, the athlete is then scheduled for the first available impact post-injury test, which we have a clinic here at the hospital with 4 doctors, 2 family practice, 2 peds doctors that are part of our concussion clinic team here. And what they do then is they have appointments set up every day in the morning. So what we do is the first available time that we can get them in, we get them scheduled for an impact test. The athlete shows up at the Sports Spinal Work Center, Rehab Center up here, and we give them the impact test. Then we send that results of that impact test with the athlete up to the provider. Once they get up to the provider then performs a comprehensive physical exam. So they're going to check balance, coordination, cranial nerves, anything else they feel they need to look at when it comes to doing a concussion exam. Dr. Weber can go more into it when she comes up here and talks about what she does. If you guys want to know, I'm not there for it. I know what the basic stuff we want to have done, but it's more to get as much information as they can to find out what's going on. So you get that information on how the injury occurred, type of student they are, number of concussions, et cetera, et cetera. All that determines what you're going to do for the care plan. They then go over the impact test and the physical exam with the athlete and parent, and then 1 of 2 things happens. If the athlete passes the impact test and physical exam, which does happen occasionally, they're cleared to start the return to activity process, which includes an exertion test. If they do not, the provider then places restrictions on the athlete. And this is one of the most important areas that everything's coming to, is the restrictions on an athlete. And it's not just an athlete, it's restrictions on anybody with a concussion. So some of the restrictions may be no school, half days of school, no test taking, reduced homework, no physical education, no computer use, no texting, no video games, no driving. These ones right here, no computer use, no texting, no video games, are the 3 hardest things on a brain when you're concussed. And this one right here is the hardest thing to take away from a high school kid. Okay? We've literally had to have parents take away a phone. But it makes a huge difference if we can put those restrictions on as soon as possible, because it lets that brain start to heal. The athlete then is turned back over to the care of the athletic trainer if they're at one of our schools where we have an athletic trainer. So what we do then at the school is we monitor that athlete every day we're there. We have them stop in and check us. We give them a symptom score to find out if they're symptom free. Once they do report they're symptom free, we take them through an exertion test. And that's an exercise test that stresses the brain to help determine if it's ready to take physical activity. So what that does is it includes aerobic exercise. So the first thing they do, I shouldn't say the first thing they do is they fill out a symptom score. Second thing they do is we do a balance check. Third thing we do is they automatically go on a bike for 20 minutes, and the one thing we tell them is when you're on there, I want to make sure when you come back after 20 minutes you're sweating. So that means we want that heart rate to go up. When they're done with that, we'll then take them through some actual more functional stuff, so sprinting, cutting, jumping. They make it through all that part. We then take them into the weight room and do a lifting part. And when we do the lifting part, it's not whether or not they can do the lift. As I tell the kids when we do it, I could care less if you lift the weight, it's how well you fail. Because what we're trying to do is we're trying to tax that brain. So everybody's heard of the Valsalva, where you actually hold your breath and you cause all that pressure in your head. That's what we're trying to do, is we're trying to actually see if that pressure that is created causes anything to come back. So once the athlete passes that, we then send them back in for a second impact post-injury test. And if they pass that, they're then cleared to start the return to activity process. With that, they go through the same process as the first. So they come down here, take the test. We send them up to see Dr. Weber. She goes through her exam, over the test, like that, and then we do it. If the athlete does not pass, the provider may modify restrictions, may decide to use prescribed medication for symptoms, may decide to prescribe physical therapy. There is therapy that can be done for concussions. And a lot of times with that too, once we get to, we say our magic point is about 3 weeks. Once we get to that point where we're at 3 weeks and we're not seeing the changes we need to see, we're automatically sending them back to the doctor. Because that's when we're looking at, do we need to put them on medication? Do they need to have something else done? Because we should be starting to see changes there. Because more times than not, most concussions resolve in 10 to 14 days. If we start getting to that 21 to 28 days, now we know there's more going on, that we need to do more stuff. Athlete follows the same process as before until then he or she passes that impact test and physical exam. Along with that, they may have other things they have to do. Non-athletes, like I say, follow the exact same process. Just the referral's a little bit different. It's coming from either a different Agnesian provider or the emergency department. They still get restrictions, but usually they are not monitored by an athletic trainer, because most of our non-athletes that we're seeing when we look at it through our clinic are either going to be car accidents, people that hurt themselves at work, or in the wintertime slipping and falling, hitting their head, or the middle school age kids, which still may be athletes, but we're not at the school, so we're not actually involved as much. And that's a total different caseload when it comes to treating concussions. They're a lot harder than an adult or even a high school athlete, because their brains are developing so much, they change all the time, and they take longer. More times than not, they're going to take that 3 weeks, if not more. They're usually scheduled to come back every week to see the doctor, or in 2 weeks. So, you've heard us talk about IMPACT, which is neurocognitive testing. What is it? It's a battery of tests that test the cognitive function of different parts of the brain. It's computer-based, and it's used to help determine the brain function, if the brain function is impaired after a brain injury. It typically involves both a baseline test and a post-injury test to compare it, but does not have to have a baseline test. We can still use IMPACT without a baseline. We then just compare it to national norms. The program we use IMPACT for each sex and age. There's probably over 1 million tests in there to compare for a norm. So it lets us know what the national norms are and where that person should be. And that's where we need to find out what kind of student they are, because that helps us determine where they should be. Other programs available are CogSport, Headminders, ANAM, which is a military one, CNS, Vital Signs, and then IMPACT, which is the one we use. What is IMPACT? It's an innovative program for evaluating and treating head injuries. It was the first, the most widely used, and most scientifically validated computerized concussion evaluation system that there is out there. It obtains objective data that measures how the brain is functioning and does not rely solely on how the athlete is feeling. We're not basing everything just on subjective data, because as I said before, they will lie. It's a 30-minute game-like online neurological exam. It measures 6 different functions of the brain: attention span, working memory, sustained and selective attention time, response variability, nonverbal problem solving, and reaction time. And it has become a standard tool used in comprehensive clinical management of concussions of athletes for all ages. But as I say in there, it is not the only tool used in concussion management. It's not the only thing we use. So just because they pass an impact test, it doesn't mean they're going back to play right away. It's used by, as you can see, several professional sports. The U.S. Army and Navy uses it. This number's a little bit old. I guarantee it's over 1,000 now, including the University of Wisconsin, and the high school numbers are even more. And then I always find this one kind of funny, the bottom one. WWE and Cirque du Soleil also use it. So why do we here at Agnesian HealthCare use it? Because we want to provide the best care possible in making sure that our athletes can compete safely. With Impact, we feel we can do that because we now have, as we say, a preseason physical or a look at how the brain should function normally. All of our high schools that we have, which I believe is 14 now schools we have, use Impact. Not all of them, every athlete does it. We, I think, are at roughly half of our schools make it required now that the kids actually take a baseline test. But it's still offered there, so it's one of those things we're trying to do everything we can to make sure we're dealing with concussions the best we can. So it provides visual and objective data to show how and at what level the brain is functioning. And it, like I said before, it does not rely on subjective observations or the athlete's self-reports to diagnose and track. So what we'll do now is we'll go through a sample test so you guys can kind of see an idea of what a test looks like, and I'll explain it as they go through it. The part we'll go through will probably take about 10 minutes. So the first thing they're going to come to, the first page is a lot of computer stuff. It wants to make sure your computer's plugged in. You use an external mouse. So what you're going to do is automatically we're going to have a clinic name for all of our schools. It's Agnesian HealthCare Fond du Lac. They then choose their school organization. We put in their date of birth. So it's a lot of demographic stuff: name, height, date of birth, handedness. A lot of that comes into play for balance. We want to know what handedness they are for balance and stuff like that. So then the next part they're going to do is they're going to fill out a symptom score. And as we tell them when they're taking it for a post-injury, we want them to rate it as they're there that morning. Where it asks questions about sleeping too much, trouble falling asleep, stuff like that, obviously related to the last time they slept or the last couple times, sleeping too little. And I believe, if I remember correctly counting, there's either 22 or 26 symptoms that they have to rate. Once they know that, they actually get into the actual test part. The first one is word memory. So what this is going to do is it's going to flash through words. I believe each word stays up for like 3 seconds. It gives you through once. It will flash through the words a second time. And what we're doing at this point in time is what we call encoding. We're checking to see if the brain is able to actually encode what it is learning right away for that immediate recall. So then it asks if the word was one of the words displayed. Excuse me. Now goes to the same thing with symbols, which this part of the test is actually the hardest part of the test. The ones they give for the sample are really easy. The ones you actually take in the test are quite difficult. So it's the same thing. You have to match the lines and they have to be exactly the same. It can't be flipped, it can't be rotated, nothing like that. And again, it's testing the same thing. It's testing recall, but now we're testing a little bit different part of the brain because we're not testing words or verbal stuff. We're testing visual. And what a lot of people don't realize is every part of this test is actually testing those 6 different parts we told you of the brain. It's actually testing multiple parts every test. This one here is, again, memory. So what you're doing is going to highlight 3 X's or O's. You have to remember which ones they are. And then along with it, so we do what we call a speed test. So this is pure reaction time. So what they're going to do is they want to see how long it takes you to react to hitting the key when a certain symbol pops up on the screen. So with this part of the test, they actually have to go through, they get the sample part. Like everything we're seeing here is a part they'll see before they actually go to the test. So they kind of get an understanding of how it's going to work. They go through the same thing. This part here, there's 4 times they have to go through and do it, where they'll get the X's and O's, and then before they have to click on which ones they were, they will then have to do this and then go back. So now we're testing memory, whether you can encode and recall, and you're getting distracted by something else. So like I said, we're trying, every part of the test is testing multiple brain functions. See, now you don't know how she's doing. And neither do they. Okay, now this one, it's a symbol match. So what it is they're going to give you a bunch of symbols, and when it flashes up, you have to click on the number that corresponds to that symbol. What you do have to do, and it does tell you with the instructions, your job is to try to remember this, because about halfway through, 3/4 of the way through, the symbols disappear. All you get is the numbers. So again, it's testing reaction time and whether or not your brain is able to encode and recall what you need to remember. We prefer if we can have a baseline, because a baseline then lets us compare them to them and not a national norm. It is not required. We can go ahead and compare that to what we do call national norm, because there is, for every female age 16, there's over 1 million baseline tests in there that they can compare what your scores should be, and there's a wide range where you can fit into there. That's why we say we prefer if we can have a baseline, because we're more accurate, because we're testing you to you. And with this, a baseline test does only last for high school kids 2 years, because the brain is developing. This is another speed test, and now you have to count backwards 25 to 1 as quickly as you can. So along with that test, what you're going to do is they're going to give you 3 letters to remember. And again, multiple parts. So you have to remember something, and then your brain gets distracted doing something else. So we're testing both reaction time, processing speed. Okay. It's actually going to stop the test here, but there's actually, when the kids take a test, one more part. We actually remember the words and the symbols you got at the beginning. That actually comes back up. So now it's what we call the recall part. So we're trying to find out if the brain, not only was it able to encode and recall it right away, was it able to keep that stored there, and are you able to get back to that? So it's one of those things we're testing both short-term and long-term memory. With that, I will hand it over to Dr. Weber, because she will go over the results and how to use them.
All right, good morning, everybody. So the first athlete we have is a 16-year-old female. She was a soccer player. She got put in at the end of the game, maybe even during the overtime period, and ended up having, she was playing the goalie position and ended up having a opposing player knee her in the head. She immediately fell to the ground, was having symptoms, dizziness and headaches. The coach came out, the trainer came out and evaluated her, felt that she may have had a concussion. So then she was pulled from the game and then subsequently came in for further concussion testing and impact. So the first thing she did is she came down and had the impact test, and then she came up by me. The first thing that I do when they come into my office is get the story. When did it happen? What were their symptoms? What was the mechanism of injury? What happened since that time? So if it was on a Friday, what did they do all weekend? How did they feel? And then I go over how they feel now. And then after that, I get some past medical history. Do they have a history of concussions? Do they have a history of depression, anxiety, ADHD? Because all of this can play a role into their response and how we treat them.
We go over a lot of social aspects of what's going on. So what kind of student are they? A B student versus a C D student? Are they in more activities other than just the sport? Do they have prom coming up? Is there homecoming dance coming up that they're really excited about? Are they in band, choir? And then do they work, or do they drive? So then after this, we go over a physical exam. So the physical exam, Tyler kind of touched on about, we do a lot of balance things. So trying to trip them up and see if I can get them off balance, checking their eye movements, making sure they're smooth. Kids, like he said multiple times, will lie. So if I can do a balance test, a 16-year-old can do a balance test. So when they tell me, no, I can't do that, I couldn't do before, baloney. So after my physical exam, I kind of know, I have an idea on what their symptoms are, what their exam looks like, and then we go through the test. Now initially after this 16-year-old athlete came in, you can see that her baseline here, she's in the 20%, 60%, and you can see her baseline scores aren't too bad. She's an AB student, so this is kind of what I would expect. Post-injury 1, when I first saw her, all of these are bolded, which means there's a significant change from her baseline. So in every area, memory, visual, verbal memory, reaction time, and visual motor speed is a significant change from her baseline. This is why the baseline is so important. I can say, yes, you've had a big change. So you can also see the symptom score, 31. Typical symptom score in a high school athlete, 7 or less. Most kids, girls tend to be a little bit higher for whatever reason, but most kids have some sort of symptoms at any point when you ask them. So then after her post-injury 1, we placed her on restrictions. So for her, I think we just took away the texting, the computer work. We kept her out of school for a day and had her go a half day, and then got her back into school, no band or choir. And then when she was symptom-free, she touched base with Tyler every day. When she was symptom-free, he made her go through the exertion test. She passed the exertion test, and she came back in for a follow-up. And as you can see, her numbers, all of them, had significantly improved from her post-injury 1, and even improved a little bit from her baseline. This is not uncommon for them to improve from their baseline. As you can see here, her baseline was done in 2011. 2 years of a growing brain from a 14 to a 16-year-old girl, I anticipate they get quicker, their memory is better. So that did not surprise me. So after she came back after the post-injury 2, we got her back into the return to play process. At that point, she was back at school, not taking tests yet, so we then started implementing full school activities also. Our next athlete was a 15-year-old young lady. She, again, another soccer player, but she had gotten hit in the head with a soccer ball, came in with the same headache, dizziness, fogginess. Post-injury 1, her exam was showed some balance issues, showed some abnormal eye movements, typical of the soccer player previously. Her post-injury 1 showed that she did have a significant change in both memory composite visual and reaction time. Her symptom score was a little bit high, 16, not too bad. We put restrictions on her, which included the no texting, no computer work, no video games, no athletics. I don't think we kept her out of school because her symptom score, half days at school, and then got her back to school. She would touch base with Tyler on a regular basis, and he was finding that her symptom score was going up. It was not slowly coming down like we would normally see with most of our athletes. So he sent her back to us. She came back in and the test looked worse. So now not only is her memory, visual memory significantly changed from baseline, visual motor speed and reaction time. So I sat down with her and her mom and I said, okay, what's going on? Are you in athletics? Are you doing anything other than taking it easy? Well, it turns out she was texting. So I said, okay, Mom, this is up to you. She can be mad at me, but you have to take her phone away. So mom did take her phone away. She kept following up with Tyler. Her symptoms started getting better. She came back in a week later, and look what a week does. Not only did her symptom score come down significantly, which a 7, like I said, I would consider for most 15-year-old girls, it would be normal, but all of her scores have now improved. So it just shows what a huge difference putting those restrictions on the athletes can make. Do you have any questions or any other comments?
I do want to say one thing when it comes to the restrictions. What most people don't realize, everybody thinks that athletics is harder on a concussion than school. That is the farthest thing from the truth. It is harder for an athlete to go through a day of school than it is for him to go through a 3-hour practice. Because there is more taxing stuff going on in school for the brain to try to focus. Because what happens, you have to realize, with a brain concussed, that brain is not able to focus on one thing. For a person concussed, going to the grocery store is torture because there's too many things going on. They can't focus on just one thing. So it's the same thing in school. Since they're not able to focus on one thing, okay, if the person 2 rows over is talking, they're trying to focus on that. They're trying to focus on the teacher. They're, umpteen different things. The other thing is, and that's why, with their exam, they check the eye movement. Think about taking tests. What do you do or taking notes? What do you do all day long? You look up and down. If you are concussed, that makes your headache worse. So every time you look up and down, you're making your headache worse because your brain's not able to focus quickly. So that constant movement causes those symptoms to get exacerbated. Yes? So the question is, which doctors are part of the concussion clinic? Here at the main campus here, we have Dr. Weber and Dr. Gina Everson in family practice, and then we have Dr. Warren Post, and we just added Dr. Nicole Schwindel in pediatrics. With that, though, we do have other sites. We have Deb Vandezan and Julie Schneider, both nurse practitioners over at the West Clinic that do it, and then we have Dr. Nagel down in Waupun, Dr. Collister down in Mayville, and both Dr. Wallace and Goydier in Ripon that do it. Yes?
At what point, if they have repeated injuries, would you restrict an athlete from participating in all of
So the question is at what point do you restrict an athlete that has had repeated head injuries or concussions? There's no set stone answer. So it really depends on how close are their concussions to one another. If they're back-to-back concussions, well, then you're really considering restricting. If there's been years between them and they recover fully, then they're back at their baseline. They should not have any increased risks. However, if it's taking them longer to recover, so the first concussion, it took them a week, second concussion, it took them 2 weeks, third concussion, it's taking them 4 or 6 weeks. That's another athlete that I'm saying, okay, we need to really look at this. Now, let's say we get them back too soon to play and they get a second head injury before that first concussion is resolved. This is why we are so concerned about treating these concussions appropriately the first time around. That second injury leads to what the popular press is getting a hold of, and the post-concussive syndrome and the traumatic encephalopathy stuff that the NFL players are talking about right now. So we don't want to get there. In order to avoid that, we have to avoid that second injury. So, and that's a piece of this also.
Along with that, there was, we actually just both went down to a conference last week, Tuesday. And one of the things is one of the doctors down there that deals with concussions down at Children's said the one question he has 3 questions he asks when he's determining whether or not they're going to be pulled from athletics or sports. Does it take less of a blow to cause the injury? Did they recover fully last time? And does the recovery take longer every time they get a concussion? He says if any one of those 3 answers is yes, he pulls them from sports. Because that means your brain then is not able and is not going back to the pre-injury level. So now you're putting that person at more risk for further stuff down the road. Yes?
Do you have to give these presentations to the community, coaches and parents?
Question is, do we ever give this presentation to the community or coaches? Actually, it hasn't been done in like 2 years, but I think 2 or 3 years ago, I think I did a presentation at every single one of our high schools. So we do try to educate and have tried to educate our schools, the parents, the coaches, stuff like that. We're actually probably in the process of looking at trying to do some more education for not just coaches, but school administrators and teachers, because they play a huge role in the recovery process. So it's not just coaches that get all the blame for everything. We have to look at, like I said, a day of school is harder than a day of practice. So we have to make sure those teachers understand why the restrictions are getting put on. Because a lot of times they look at Johnny and say, okay, he looks normal to me, he can do everything. That's not the case. You can't see what's going on with a concussion. It's not like I can take an x-ray and you get to see a broken bone and you can show everybody the x-ray and you put a cast on it. With a concussion, there's nothing that shows that that person's injured. Yes?
We've done a lot of talking about high school sports and athletes. What about the basic college student that's involved in intramural sports? How would they know that they have possible concussion? And what would you tell them to look for if they get injured playing intramural football, intramural hockey, intramural, there's a lot of intramural sports and those college kids really don't know what to look for. What would you tell them?
So the question is, we talk about high school sports and stuff like that, with the college athletes that play a lot of intramurals, even high school kids that play intramurals that aren't part of a sport. What do we tell them to look for to let them know that they may have a concussion or something may be wrong? The biggest thing is, if you don't feel normal, there's probably something going on. A lot of times what you're going to notice with a concussion, the one constant when it comes to a concussion is probably going to be a headache. And the second most common symptom is going to be pressure in the head. Because what's going on with that metabolic imbalance or that dysfunction going on in there, you've got a lot of stuff going on in the brain. The other most common thing is a person with concussion is tired. And they're tired a lot. And actually, some of that stuff is the stuff that started to change a little bit too. It used to be they would say, as I would tell my high school kids, if you're tired, it's your brain telling you it's trying to heal. So go ahead and rest. What they're actually going to now is not necessarily letting those athletes or those people with concussions sleep all day. What they want to do is they want you to get so you're still in your normal routine. So you may be able to take like a 20-minute to a half-hour power nap, but that's about it. They then want you to still, yes, rest, but not sleep, because they want you to still get that consistent sleep every night. So you're still going to bed at 10 o'clock at night instead of sleeping for 4 hours during the day and all of a sudden you're not going to bed till 2 in the morning. They want that brain to be in a regular routine for that. So, but it's one of those things. There's no definitive thing that says yes, you have a concussion. Some people suffer from migraines and may have a headache that lasts a couple days. That doesn't mean you have a concussion, But there's one of those things. The biggest thing I can say is if you just don't feel like yourself, there's probably something going on, and especially if you can relate it to some kind of a hit or a blow or something like that, then your best bet is to probably, get looked at, whether it's your health provider at the school, the athletic trainer at the school, whatever, stop in and get looked at to have somebody else give you an idea. Yes?
What's a diagnostic and treatment tool for someone under the age of 12? When you start at 12, what happens for kids under 12?
We don't have the ability because we don't have access to a neuropsych doctor all the time. So they'll go through a different battery of tests because there are some written tests and they have different stuff that are done for that age. They did just with the SCAT-3 develop what they call a child SCAT-3. So that will be our diagnostic tool we'll use a lot of times now with them. We'll put them through that SCAT-3 exam, that child SCAT-3. And again, it's the same thing. It's still looking for the same stuff. It's just at a level their brain can handle. So it's not as complex of words, it's not as much stuff to go through, but it's still testing all the same stuff. So Impact has been trying for years to say they're coming up with a child version, and the hard part is the brain is changing so much you can't come up with a norm. So you'd have to have a baseline, and that baseline is probably valid for 6 months because the brain is developing so much it changes all the time.